Hey guys, welcome back to my channel. My name is Wendy if you're new here, and today is going to be a nursing Q&A video. I asked here on my YouTube through the community tab if you guys had any questions, and those are the questions that I will be answering. I also asked on Instagram, and I also got a question there. So let's get right into the video. Now I will be looking at my phone because obviously the questions are there. So we're just gonna start off with the first one, which I've already answered in the comments, but I wanna answer it here too. So this person asked, any tips on how to study for the T's and the Kaplan? They've taken it twice and they've scored the same score. So I did tell this person that I took my T's 11 years ago. And honestly, back then, like, there were not as many resources as there are now, especially on social media. And I'm sorry I could not help you with this specifically, but do know that I did research a little bit for you, and I saw that all I kept seeing was ATI pop up every time I put the T's. So maybe you can try purchasing an ATI book for the T's exam and see if that would help. Like I said, I kind of just winged it, and like I said, I'm not telling you to do that, but that's just what I did because I didn't really have any resources. I also used the ATI books in preparation for the NCLEX through nursing school, so they did help me. So maybe the T's prep, so maybe the ATI prep for the T's will also help you. So if anybody has any resources that they can share with us, please comment down below and let us know how you study for the T's or what resources you use to study for the T's so that we can all help each other out. Now, moving on to question number 2, and I'm just gonna read it. It says, I don't feel like nursing is for me and I have completed my ADN. I am an introvert. Do you have any ideas of what careers I can pursue related to healthcare? So if you want to stay in the nursing field, which I hope you do because you said that you completed your ADN. Now, let me just tell you, I am an introvert. Like, I am very shy around people. Like, I don't like talking to people, and it takes me a long time to open up to people. So it was very scary for me, but with time, it gets better. So I know that you might think that it may be a little too hard for you right now because you feel like you're such an introvert, but you really learn all these communication skills throughout your career. And honestly, I'm like super duper shy, so hang in there. Like, if you do want to stay in nursing, I suggest maybe you could do like well, if you are at the bedside and you're a new nurse, maybe you can try working night shift, which I know is not ideal, but night shift, like, you don't have as many doctors around, you don't have as many people around, you don't have to talk to as many people as you would during day shift. So maybe doing that switch can help you a little bit. Now, the other thing that you can do is obviously like any nursing work over the phone, like telephone triage, because you're not directly talking in front of the patient. Maybe that will make you a little bit more comfortable. Or the other thing that I can think of at the top of my head is maybe home health. So for home health nurses, they're very like autonomous. Then you're doing more one-on-one care with the patient. So you might not feel as overwhelmed because you're not having so much stimulation from everybody else around you because you're giving your undivided attention to that patient in the home. So maybe you could look into that. The other thing that I can think of is doing like chart reviews. You could do this from home as well, like or an auditor, like a chart auditor, chart reviewer. Those are probably things that you could do from home too. But if you are a new nurse and you haven't explored all these different nursing like specialties, like, don't give up. Don't give up so fast. I know it's hard and I know it could be scary and intimidating, especially as an introvert, but with time it'll get better. And just try to find your nursing niche, like where it is that you like. Some people don't find their niche for a long time. Like, even at this point, I'm like, yes, I like primary care, but do I really want to stay there forever? And I've been a nurse for 9 years. So I'm thinking maybe as an FNP I'll do primary care, but at the same time it's like, I don't know. So it's okay to not know, but just know that there are nursing options for you if you are an introvert. And like I said, it does get better with time. You get more comfortable with your communication skills. So just don't lose hope, please. All right, so moving on to question number 3. When you feel burnt out at the job, what is your why? Okay, so this is a very good question because my why is always my patients. I want to be able to help as many people as I can. I want to be able to make a positive impact in their life, in their healthcare. And I know it could sound super cliche, but that really is why. And I've always wanted to be a nurse because of that. You know, being a nurse, like the nursing model is so different than the medical model, I think. And I really, really enjoy working under the nursing model because you really take care of the patient like in a holistic way, you know, mind, body, soul. And that's something that I really love about nursing. So moving on to the next question, somebody asked if I had any tips for new grads. And yes, I do. I think the most important thing is to not be so hard on yourself. You are not going to know everything, and that's okay. And everybody else around you understands that you're not going to know everything because nursing, the medical field actually, is a learning curve. Like it's a learning process for the rest of your life. So you're not gonna know everything. And always remember though that patient safety is first. Time management is super important. But like I said, you don't have to know everything. You will learn it with time. Don't be so hard on yourself. That's huge. Don't be so hard on yourself. Been there, done that. It's hard. So moving on to the next question, and the question is, anything you wish you would have done differently about your nursing journey? Now, I have talked about this before, like my biggest regret of my nursing career, my nursing journey, is not working in the ICU. I totally regret that because I don't know, I feel like I would thrive in the ICU. Like I am very introverted, but at the same time, like I like to focus on 1 or 2 patients. And I think I just would have loved ICU. And unfortunately, I left the bedside before I could experience working in the ICU. But maybe one day I'll decide to go back just to try it out. But I don't know. You guys know how I feel about the bedside. But the ICU is definitely something I totally regret not doing, and I wish I would have done it. So moving on to the next question, somebody is asking if I have any advice and tips for clinicals. And I've only done 1 clinical rotation for NP school. So my first advice is, of course, to always be on time to your clinicals. Number 2 would be to do a lot of like practice questions. And if there is like a diagnosis or something that you are not very familiar with, write it down. And once you write it down, make sure that when you go home that day that you read up on it so that you can remember for the next time, because most likely you're going to see it again during that rotation. So make sure that you are writing these things down and researching. And the next tip would also be to ask questions. Don't be afraid to ask questions. Nobody knows everything. And that also goes for my tips for the new grads. Also, most likely if you're in NP school, you have to input all your patients that you've seen throughout the day. I would highly advise to not leave that for the end of the week or for the end of the month. So don't procrastinate in putting in your patients for your clinical day on that same day, because you're definitely going to regret it when you have a huge pile like this that you have to input all those patients into the system. It's not going to be fun. So don't do that. Don't. I even tried to do like 2 or 3 days worth. It was horrible. It took me hours. It took me like a whole day to put it in. So don't procrastinate on it. And the last question is, what's your best advice for nursing students? So my best advice for nursing students is to be proactive and to volunteer to do tasks. If somebody needs an IV, go put an IV. If somebody needs a Foley, go do that. Because all those skills are going to be very helpful for you once you start working as an RN, and you'll feel more comfortable. Also, remember that you're the one in charge of your education. So if you're not volunteering to do things, this goes for NP students as well. Like if you're not volunteering to go do certain tasks or to go see a certain patient that is like critical or has something unique about their case, then you're missing out on a very good opportunity to be able to experience and learn more about that specific condition or disease, patient, etc. So just remember, you're in charge of your education, so you have to be proactive. So I hope that you guys enjoyed this video. Hopefully it wasn't too long. If you guys have any other questions, put your questions down below. I can do another nursing Q&A next month. I will be doing more in-depth videos on these specific questions, like tips for new grads, tips for nursing students, because there's a lot of tips I have, but for the purpose of this video, I kept it short and just kind of whatever came to mind. So anyways, I hope that you guys have a great day. Make sure to like this video, subscribe, and I'll see you on the next one.